No, it's just after 20 to 5. 1 in 4 women in Northern Ireland are taking antidepressants, according to government statistics out today. The figure for men is 15%. The Northern Ireland Statistics and Research Agency figures show a disparity, though, in deprived areas. For instance, in Derry and Strabane, in that council area, the figure for all adults is almost 24%.
We're going to look in detail at the figures tonight and ask what this says about our society and what's the cost of this, what cost does it entail both to the health service and, more importantly, to people's overall health and well-being. And of course, just to be clear, this is a type of medication that does help thousands of people across Northern Ireland, but there has been some concern over the rates of use here compared to other places. For example, the figure in Britain is much lower. It's 1 in 7 of the population.
Well, Sara Boyce is from the human rights group PPR, and we'll go through the figures with you, Sara, in just a moment. But first, let's talk to Siobhan McCallin, a retired primary school teacher from Belfast, who's also joined us in the studio. You're both very welcome to the programme. Siobhan, tell us a little bit about your journey with antidepressants.
Yeah, so I had a sepsis ordeal in 2016, and as a result of that, I was diagnosed with ME, a severe debilitating illness. I had to medically retire, and I was only 36 years of age. It had a devastating impact on all aspects of my life. It's a bit like mourning yourself. I lost my role as a teacher. I lost my role as a mother and a wife because I was mostly bedbound and housebound. And, you know, the things that normally helped me in previous decades with health issues, including a left nephrectomy and a hysterectomy. I had induced menopause and lots of other serious health issues, but they were all not related. So during the period of induced menopause, antidepressants really helped. But with the ME, I didn't know what I was facing. It was a different beast than ever before. And at one stage, I was more or less bedbound for 8.5 months. Wasn't able to do anything for myself, relied on my family for everything. And it's a very dark, lonely place to be, a very lonely journey to be on. And the more medication I was taking, the worse I felt. The feelings of worthlessness, and I did have suicidal tendencies. I got involved with Sara through our writing group, and it's just been transformational in the sense that it's given me a different outlook on life. I've been able to find voice through writing and being empowered by being involved in the mental health campaign. I stopped taking the antidepressants because I felt that they were making me feel worse. Through self-empowerment and literature that helps heal, I found a way of finding joy again.
And was it difficult to come off the antidepressants? Because that's where it can be very tricky for people trying to wean off and make sure that that's not a dangerous thing to do, because you don't want to see a situation where somebody's mood then drops further.
Yeah, and that was the case with me. I was on so much painkillers as well. I was on Lyrica, I was on baclofen, which is an MS drug, but I was written it off script. And my GP is fantastic, Dr. Michael McKenna, and he has always sort of any decision making regarding, you know, removal of medication. He's always sort of walked a very careful path, but I decided that I didn't want to be on the antidepressants because they were making me feel worse. I don't know if I had withdrawal in the sense that I did with opioids, but I certainly felt that they were making me worse rather than feeling better. And I've just found an alternative way of finding therapy through writing and surrounding myself with positive literature and things that can help you, instead of allowing the negative chatter and the ego to dictate everything that's happening and making you feel like you're completely worthless, that you're no good at anything, that you really, life wasn't worth living. I found a way of just finding joy through nature, through just being involved with people, connection is very, very important, and I was very isolated for a long period, and so the pandemic actually opened up so many opportunities for me. Zoom was revolutionary in that it enabled me to, because of the illness and how my mobility suffers at times, I would have not been able to get out of the house. So Zoom was like the best thing ever, and to be with like-minded people. So that's how I met Sara, through a writing group at Glornamona. And she invited me to take part in another writing group with Michael Patrick MacDonald, The Rest of the Story. And it was trauma-informed, and it actually made me realise there were so many traumas in 2 decades of serious health issues. But the loss and the mourning of the previous person you were, I've now got to this stage of acceptance. And
That's so, you've been obviously very fortunate in, you know, the people that you have met, and the fact that you have been able to sort of find this new lease of life. But I mean, how long were you on the antidepressants for?
I think I was on them for a few years. And at that stage, that was early on, post-sepsis and the diagnosis of ME. And it was actually the consultant in the hospital had put me on, I was on sertraline and duloxetine. And I think it was more, people don't really know how to treat people with ME, despite there being 5 decades of research and proof that it's a neurological and an immunological disease. We're seeing a massive explosion due to long COVID, because long COVID, it's suggesting that it's viral onset ME, which is what happened to me. But that signposting, if there was more signposting, if people were aware that groups like us exist, that there are alternatives, you know, we're going around with the travelling apothecary.
I suppose the whole point is that antidepressants aren't, you know, supposed to be used in the, you know, long term. They're to maybe help people get through. Well, I suppose every case is different. But Sara, would bring you in on that. Do you feel that the issue is more around the longer term use of antidepressants?
Yeah, I suppose the first thing to say is that, I mean, the data, and you've sort of highlighted some of the headline figures that have come out today. I mean, this data is really, truly shocking, and it has to be sound the alarm across society with government. You know, year on year, this is not something, I think it's important as well for people to know that this isn't a spike. This has been, over the last 20 years, there's been a 4-fold increase in prescribing of antidepressants. So this is a trajectory that has continued for at least the last 20 years. So we are essentially medicating pain and trauma. And
what do you put that big rise down to? Is it people are happier to come forward and talk to their GP about mental health issues? Is it GPs over prescribing? What do you think the factors are behind that?
Well, I think the evidence that we're looking at, I mean, you know, we can kind of speculate about what's going on. GPs themselves would say that they really have no other options in their toolbox a lot of the time, unfortunately. They've a 10-minute slot, and it's either, you know, right on the prescription pad. There isn't the access to talking therapies or the types of things that Siobhan has been talking about that are so helpful. So, you know, GPs often have no other option. But when we have looked at the data and the figures, and this is really important, the spend, because, you know, when you look at the money and really follow the money, that tells an awful lot. So in 2022, the spend on talking therapies here was 1.9 million across the entire 5 trusts. I mean, it's hard to get your head around that's the overall budget for talking therapies. The spend on antidepressants was 13 million. That's the average year on year. But in 2020, the cost of antidepressants went up by 7 million in 1 year because there was issues around supply side. We still paid for that. We still paid for that increased cost. So that to us is the issue. You know, where the priorities are and where the money's been spent. We need to really start flipping the script and moving away from prioritising a medication first response.
I mean, it's interesting though as well when you dig into the figures and look at how much, and this is similar to attendance at accident and emergency departments. About 75% of people who attend our own emergency departments come from deprived areas. And the same thing is happening here. You're much more likely to be on an antidepressant if you're living in a deprived area. So there's a bigger, wider societal issue here, isn't there? I mean, but I suppose you can't get away from the transgenerational trauma aspect of this either. You have a whole kind of generation of people who are perhaps were on antidepressants because of troubles-related trauma that have then perhaps perhaps pass that on to their children as a coping mechanism. So how do you ever break that cycle?
Yeah, I mean, I think you're right that there is a bigger, wider conversation we urgently need to have about this. On this, I mean, we do need to hear from the Department of Health and from the Chief Medical Officer, because this is a public health issue and a very serious public health issue. But that's something that, Siobhan talked about. Communities are, because they're living it and they're seeing it, it's a quarter of everybody living in the poorest areas are on antidepressants. That is shocking. You talked at the start, Catherine, around the cost, the human cost of this. Somebody has to have oversight of this and say, is this really where we're going to continue going as a society? So communities have come together through the new script for mental health, and they're having these conversations because they're the people really living with it and feeling it. And one of the things they've done, which is so interesting, they've invited people to share their own new script, because some people, yes, it is antidepressants, but for other people, like Siobhan was describing, it's lots of other things. And what's come through out of that, there are, I think, 122 new scripts filled in. Not one person has said they want more medication, that we need more medication. But the top thing that has come through in terms of people's personal new scripts is access to the arts, access to creativity, access to nature, all of the things that we know help people heal from difficult experiences, and then access to therapies and group therapies. So connection and community, these are the things that people are really saying we need to prioritise.
And things like social prescribing, if people aren't aware. Absolutely. That, I mean, I know it's very kind of strong in the Derry area, and it has been introduced elsewhere. Is that something you think should be rolled out on a much wider basis?
Yeah, I mean, all these things like...
That was my new script for mental health, actually. My sister is leading the charge in Liverpool on social prescribing. She was also a school teacher. She begged me to lift the pen and said, you're more than just this illness. Please do something to try and find a way out of your head and back to the person who you used to be. And I think social prescribing is so critically important. In the 6 years or 7 years since my diagnosis, this year is the first I've been offered any kind of alternative therapies through social prescribing. So I attended the Maureen Sheehan Centre, and we were able to get a neurophysio in who explained what's happening in your brain, nutritionalists. I attended sessions of hot pool therapy. These things, whenever you've gone from having a job to going on a medical pension, you don't have the same amount of money that you used to have. That also fuels your mental health crisis, not being able to afford to pay your bills. You can't access these things privately to go and join or sign up to writing groups or writing therapies. So I think that it's critically important that social prescribing is invested in, and garden therapies or other things that will help other people to heal.
Yeah, but I mean, obviously it is important to state that antidepressants are literally life-saving in cases, and it would be dangerous to suggest that people shouldn't be offered them and shouldn't be taking them.
Yeah, absolutely. And I'm glad you raised that, Catherine, because that's something that is very, very important to say here, that the data is going in the wrong direction completely, but we need to be very careful, in terms of the messages that people are hearing, that it is, we absolutely are not saying that people should not go on antidepressants or that they should come off them. Absolutely not. We know how dangerous that can be for people. There is guidance from the from NICE, the National Institute of Clinical Excellence, and the Royal College of Psychiatrists. We have put that guidance on our website this morning, nlb.ie, so we'd encourage people to go and have a look at it, and encourage people, really, that's what people need to be guided by, and with their GP. We think that really the Department of Health and the Chief Medical Officer also need to come out and share some guidance and take some leadership in this, because following the Panorama programme recently, where we now know there's a lot of evidence around the risks of withdrawal from antidepressants, and also the longer you're on them, the more difficult it is, the dependence. And that's the data we need to see. Hasn't come out today as the data on long-term prescribing, and also more detailed data on under 18s. So we'd be calling on the department and the Chief Medical Officer because people need that. They need it to be able to make informed decisions around taking antidepressants, and also if they choose to come off them.
Thanks both of you, Siobhan and Sara. Really appreciate hearing your views on that, and that conversation that will continue, no doubt. But thanks for now.
Thank you.